hello to you all.
Hi,
Hi.
Tony.
Hello, Tony.
Hello. Right, let's start with Stephanie. Now, you suffer from um, sickle cell disease. Tell us what it is.
So sickle cell disease is a genetic blood condition, and it affects the red blood cells. And what it does is that, so obviously most red blood cells are round, but with sickle cell they have the propensity to change into a sickle shape, so a moon crescent shape. And when it does that, they'll all clump together in a certain area and block the oxygen from passing through. And that can lead to really painful episodes, which we call a sickle cell crisis.
When did you know you had the condition?
I think I realised, maybe when I was about 7 or 8. My parents obviously knew a lot longer than that. But it's when I, could see that I couldn't do certain things that my friends were doing. Obviously then I was like, okay, yeah, there's something wrong here.
And how has it impacted on your life generally?
So sickle cell obviously is a very debilitating illness and an unpredictable illness. So it affects my life, every day. There's some days I can wake up fine and end up in A&E that afternoon or that evening. A lot of the times I've had to cancel on my friends at, the very last minute. I'm very grateful though that my friends have been a really good support system and they've never made me feel like a burden, even though sometimes, just as a person suffering the illness, you feel like a burden to others, even though they've never made you feel like that. But you just feel it's unfair that I have to cancel, or it's unfair I can't do this or that or the other. But yeah, it does affect my life every single day.
So, how are you feeling now? Having this conversation now. Would if I were in the same room as you, would I know whether or not you were suffering?
No, you wouldn't. Like, I look really nice today. Got ready. Even though I'm in pain and I've had to take medication before this interview, you wouldn't really notice that I'm sick, unless obviously I told you about it.
Which you're doing very eloquently now. Thank you very much.
Thank you.
Virginia, let's move to you. You're a clinical specialist. How does what sort of impact does it have on your day-to-day work?
Oh, hi, Tony. So I'm a clinical nurse specialist for sickle cell and thalassemia. And day to day, my job, I think my predominant job is actually advocating for my patients, either within the trust where I work, so with my colleagues, the doctors, the nurses, healthcare, and also externally, so with GPs and any other services that they might come into contact with. So it's quite full on. It's very rewarding, but that advocacy work is very, very important, because even within healthcare, where you kind of assume that people would know about the condition and how to treat patients, that's not always the case. So just being there explaining what's wrong with that particular individual, because every patient is different. So sickle cell is an umbrella term, but how it affects individuals varies. So no two people are the same. So it's actually getting to know my patients and being able to advocate for that individual at that particular point in time.
So we've heard Stephanie's story now. How would other patients differ from, say, Stephanie?
I would imagine every other patient will experience what Stephanie's experienced in terms of they have pain all the time. Because one of the misconceptions about sickle cell is that once they've had their pain relief, it disappears. It doesn't. The pain is there all the time, but the degrees, the severity varies. And that whole juggling your life, not knowing when you're going to have a crisis, if you're a young person and you're doing exams currently, you don't know whether you're going to have a crisis when you wake up tomorrow, which then means you potentially can't go and do your GCSEs or A-levels. And as a sickle cell nurse specialist, it's my role to contact the school, to write support letter so that actually they don't fail just because they couldn't be there. It's nothing that they could do to have prevented that from happening. And the whole kind of exam environment is also very stressful, and stress brings on the crisis. So you have that kind of rolling kind of cycle in terms of how sickle cell impacts. So I very much understand Stephanie.
Is there a sort of certain element of the population that is more likely to suffer from the condition than another?
So sickle cell in the UK is predominantly people of African, Afro-Caribbean backgrounds, but we have patients who from the Middle East, from Asia, Southern Asia. So there's this misconception that you have to be black to have sickle cell disease, but that's actually not the case. And this is why we have the national screening program, because all babies born in the UK should be screened for sickle cell. And that's how you will know, because you don't actually know just by looking at somebody that they have sickle cell. So yes, the majority of patients that we see are from those backgrounds, but it could be from any other. I have personally met sickle cell patients with very, very severe phenotypes of the disease from Southern Europe. I went to a conference a few years ago, and I was, it was meant to be a conference for people with sickle cell disease. And I walked in the room and I saw a couple of people, blonde hair, blue eyes. And I was like, okay, are they meant to be here? And then when they started telling their stories, then my eyes opened. So yes, even I, with my background, I'm still always amazed. So yes, I think days like this is about raising awareness and people not having those biases and making assumptions about who has and who hasn't, because actually you don't know.
But you say, you've met people from Southern Europe. Is it unlikely to affect somebody from Northern Europe?
Predominantly, yes, unlikely. However, given what I've just said, that until people are tested, you don't actually know who has a trait, and then potentially can then pass it on to their offspring. So, and especially in this global world that we live in, where people are intermarrying, there's loads of kind of relationships going on. So yes, it's actually better not to make too many assumptions.
Yeah, quite right. So Sherry, you're a carer. How does sickle cell impact on your daily life?
So, as these two ladies have said so eloquently, as somebody suffering with sickle cells and from the medical profession, we all end up we work together. So and we work with the families as well. The family has to support the patient with sickle cell, and that means, as you've heard, it's very difficult to plan. It's very difficult to plan a holiday or plan days out. I can give you an example that I will send my son off to school. He'll be absolutely fine. And within 10 minutes, I'll get a phone call to say, he's ill, you need to come quickly. I got married a couple of years ago, and my son had, to me, he looked absolutely fine. He walked me down the aisle. He gave an absolutely fantastic speech. He smiled all day. And then I got the tap on the shoulder to say, he's not well, you need to come quickly. So on my wedding day, I ended up in A&E with my son. And that is something that's planned years in advance. And the thing is, no 2 days are the same. So the day before, they may be absolutely fine and look wonderful to you. And the next day, or by the end of that day, they can be in hospital. So as a family, we take on their pain with them. We hear their cries, we feel their cries, and there's so many of us who are here actually supporting one another. And it's important to remember that, as we're saying, June 19 is World Sickle Cell Day, and it is important that we talk about it as advocates. We make sure we promote it, we promote awareness. But sickle cell warriors and sickle cell families are living with this every single day.
You mentioned your son. So what I'm wondering is, it's a genetic disease, as Stephanie mentioned. So if one or either of the parents have the disease, is it going to be passed? Is it going to be passed on, or can it miss generations?
So it's a 1 in 4 chance. Basically, if you have two parents that both have the sickle cell trait, you have a 1 in 4 chance of having a child with sickle cell. And just to add to that, I didn't know I had the trait. I did not know I had the trait until I was tested when I was pregnant. So again, it's creating that awareness, especially within the community. And regardless of who you are, make sure that you are actually tested and you're aware and you can make informed choices about your future.
So you've gone through much of your life without realizing you had the trait. Is it likely to get worse as you go, as you get older?
What do you mean in terms of actually knowing whether or not you got the trait, or whether or not my son is likely to get worse?
I mean, are you, well, I mean, you say you have the trait, but it doesn't mean to say you've got you've fully got sickle cell disease. So what I'm trying to say is, will your condition change as you get older?
Well, having the trait doesn't necessarily mean that you suffer with any of the conditions. There has been research to say that sometimes if you have the trait, you can actually have some of the conditions, the achiness, the susceptibility. So having the trait doesn't necessarily mean that you're going to suffer from that. Stephanie, my son, actually have the full condition, which means they are predisposed to actually having a sickle cell crisis, which is life-threatening.
Virginia, just to come back to you, how can you plan if you find that somebody's either got the trait or the full condition when they've been tested? Can you mitigate some of the issues with the condition?
Yeah. So if we, for example, I'll speak from a kind of my patient perspective. So obviously, I work with patients who have sickle cell disease. They don't have the trait; they have the disease. Now, if a woman or a man comes and says, "I've got a partner and we want to start a family," so they will have counselling. So there is a counselling service within the area in South London where I work, and then they will be told, so the other partner, who we don't know what their status is, they will have a blood test to check whether or not they carry the trait. Hopefully, if they had the disease, they would have known about it by that point. But certainly, for someone that doesn't know anything, they will have a blood test and we'll see whether or not they have the traits. If they have the traits, then, of course, the discussion is then to let them know that they have a very high risk of having a child or even two children with sickle cell disease, because you've got a partner who is fully sickle cell, who has the full condition, and then you have their partner who has the traits. So that combination will most definitely result in a child with sickle cell. And so they have the options to decide if they want to go ahead, because obviously, like everybody else, they can decide not to proceed with their pregnancy and say adopt or even have IVF treatment. So those are kind of like the options. We're not in the business of blaming families. We're not going to say to somebody, because you have sickle cell, you shouldn't be having children. That's totally wrong and shouldn't be happening. So we don't do that. We support individuals to have a safe pregnancy and safe delivery. And I'm very, very proud to say that where I work, we have a very, very good success rate in terms of our pregnant ladies having very healthy babies despite their condition.
And in terms of people that have the fully blown condition, does it affect their life expectancy at all?
Absolutely. So, sickle cell is very, very debilitating, as Stephanie has explained. And because it affects all the organs in your body, if you can imagine, sickle cell will wear out your bones. So you could end up with avascular necrosis, particularly in the hips and the knee joints and shoulder joints. That's a very painful, very chronic condition that isn't going to go away unless you have surgery to amend that joint. It affects your heart. It can affect your liver, your kidneys, your skin, because some of our patients have ulcers that just don't heal, similar to diabetic ulcers. And that's because there's no oxygen going into a wound that would have started at something very, very small, and it just grows and it doesn't heal because that area isn't getting enough oxygen when the body's sickling. So it's very, very debilitating. And if you have a leg ulcer, I mean, I've known patients who, because they've had leg ulcers, their wife or their husband has left them because ulcers, if you ever work in healthcare, can be very smelly. They're not the most attractive things to have. And so not everybody can cope with that. So you have that kind of body image issues that comes with it. And even if you don't have any exterior presentations of the condition, sickle cell stunts children's growth. So particularly in school, a lot of our young people are singled out because they're not quite the same height as their peers. And so they're prone to being bullied, prone to being called thick, stupid, whatever. So and when you have that starting at that age, you can imagine the impact as you get older and the effect of that. Some of our patients are working and their employers are not so accommodating and giving them the flexibility to work from home on occasions or to attend appointments. And so they're having to hide that they have the condition. And then my job as their advocate, if you like, is to kind of help them to overcome that, because you will become ill and you have to be able to say to your employer, I need to go to the hospital to have my blood tested to get treatment. It shouldn't come as a surprise. And to be honest, once some employers know, they're actually very, very supportive. They will ask for letters, which we're always happy to write. Similarly with schools. So today, the things that we're doing today in terms of the awareness is about raising awareness with the wider community, but also encouraging our sickle patients to be confident in stating that they have this condition so that the support is given. Because if you don't ask, you're not going to get. And, they just assume that people aren't going to give them so they don't ask. But actually, they're often very surprised once they've asked, that the support is there. So I want these sessions as well to be something for our sickle community to know that the support is out there, but be confident to express it.
And how is the condition treated?
So we have we're actually at I would say, a very exciting time in terms of sickle cell care and treatment, because probably 30, 35 years ago, the life expectancy was about 35, 40 years maximum. Now we have patients who are living to their 60s, their 70s, relatively healthily. So treatments varies. There are some medications, but there's also blood transfusions, red cell exchanges. We've now got opportunity to do stem cell transplants for adults with sickle cell disease. We've got, hopefully in the future, the opportunity to do gene therapy, which is being looked into currently. So I think the future is very positive. There's a lot of research and trials going on, and I feel very positive for Stephanie's generation and the ones coming after her, that there will be more treatment options that we can give that will actually give them a better quality of life.
And how can people get involved with World Sickle Cell Day on the 19th?
So they can come on your radio station and talk about it, talk about their experiences and, speak to their healthcare providers. So if your GPs, if they haven't got anything showing in the practice waiting room, ask them why they're not, because every practice in England will have a patient or two that is a sickle cell patient. And so therefore it's to have that visibility is really, really important. I want people I want people to feel free to ask questions, so don't be shy. No question is a silly question. So if you're not sure what sickle cell is, just ask. We're going to be very visible. I'm going to be wearing my red T-shirt on that day when I go on ward round. And we are coming out for sickle on the 19th of June. But I also want to say that I want sickle to become mainstream. I don't want sickle to just be a 19th of June event every year. We want it to be mainstream, because once it's mainstream, the education will follow. So nursing education, medical education, healthcare professional education will follow. And actually, we won't have people then asking, oh, when did you develop sickle cell? Was it when you were 2 years old? And can you be cured? And also people offering you all sorts of portions to cure it. So, yeah, that's hopefully where I'm hoping that the 19th of June, but not just 19th of June, every day of the year.
And where can people go to find out more information?
So the Sickle Cell Society has a lot of information online. In fact, NHS websites of sickle cell information online. It's been updated, as we speak. Obviously, all the NHS trusts, we have information online. I mean, if you just Google sickle cell, it's there, and, you'll be pointed to various organizations. So this isn't a disease or a condition. And actually, let me just also be clear. When we use the word disease, it isn't because it's contagious. That's just what it's been called. Okay. So this isn't a condition that isn't widely known. It's one of the first red cell conditions to be discovered ever. So this is a very, very long-term known condition, and so there's no reason for people not to know about it.
Can I say I've learned an awful lot in this past few minutes. So thank you all for being so frank and discussing the condition so well. Thank you all very much indeed for your time today.
Thank you,
Thank
Thank you,
Tony.
Tony.